So good evening, everyone. I'll let Joanna share the slides. Yeah, so I was asked to speak about the essential medicines list here in Malaysia. Next slide, please. I'll cover four main areas, basically what the national EML is and how it's used, is it impactful or not. Secondly, are any MS-DMTs listed, which ones, how did they get listed, why were these specific DMTs chosen? Thirdly, what are the opportunities for next steps? And lastly, whether the MSIF WHO application, if successful, how we would use it and what support would we need if we moving forwards with this. Next slide, please. So just give you a brief overview about the Malaysian EML. I think everyone is familiar, the EML, the WHO EML is a registry where it's basically there's a minimum medicine that's needed for every healthcare system. And the basic concept is that high priority drugs should be available as part of a functioning health system at all times for all people, guiding physicians to evidence-based and rational prescribing. Next slide, please. So with regard to the Malaysian EML, this is the front page of the latest edition just published in 2023. So the Malaysian EML very closely follows the WHO EML definition, and it was first approved by the Ministry of Health in January 2000. And since then, in line with the Malaysian National Medicines Policy, it ensures universal access to medicines. Now, this EML is updated every 2 to 3 years and follows very closely on the WHO organization model list of essential medicines as well. And what it is basically, it's a list of basic medicines that satisfy the national healthcare needs of the majority of our population. And the medicines are in the appropriate dosage forms. They're made accessible to individuals or communities in appropriate quantities with guaranteed quality and at affordable prices. So every single word in this definition is important to us because we can use it whenever we go back to the administrators and refer to this document. So the main goal is to safeguard the availability and affordability of essential medicines to the Malaysian population. It aims to rationalize the procurement of medicines and encourage the rational use of medicines. And of course, it also aims to act as a uniform guide for facilities in both the public as well as the private sector. Next slide, please. So how impactful is the EML locally? So I'd like to just share one of the success stories from our gastroenterology group that has really spurred us locally to try and make this a success. The hepatitis C story. Now, everyone knows that hepatitis C treatment is expensive, especially with regard to the antivirals, and a generic version of sofosbuvir in combination with ravidasvir was trialed for patients with hepatitis C in Malaysia. Now, this was in collaboration with and I'm sure some of you may know this, the Drugs for Neglected Diseases Initiative Group, and they launched this phase 2-3 study both here in Malaysia as well as Thailand to assess the efficacy, safety and tolerability, pharmacokinetics and acceptability of ravidasvir plus generic sofosbuvir regimens. And this was a trial that was co-sponsored by the Malaysian and Thai Ministries of Health, together with some of these international organizations. Now, as you all are aware, the on-label antivirals are very, very expensive, and it's very difficult to access this. So this was quite revolutionary at that time when the local governments were able to support in collaboration with DNDi and do this trial. And we have roughly about 400,000 hepatitis C patients in the country. Next slide, please. So the publication finally came out in 2021. And with this publication, the National Pharmaceutical Regulatory Agency, or NPRA of Malaysia, granted a conditional registration for ravidasvir. And this really revolutionized the access to hepatitis C treatment locally. So in 2022, ravidasvir, which is actually a more economic option of an antiviral was officially launched in Malaysia, with the first patient treated with a combination of remdesivir and sofosbuvir. And remdesivir was included in the EML, national EML, and the Ministry of Health Medicine's formulary. That means it's available both on the EML for public-private use, as well as now in the public hospital formularies. So in 2023, there is a plan to roll it out to all the state as well as district hospitals. So this was really a very useful example of a global as well as national level collaboration. Next slide, please. So coming back to MS and what treatments are available locally. So the current treatments which are available locally are the on-label NPRA approved drugs, which there are 8 in number at the moment: the interferons, teriflunomide, fingolimod, DMF, natalizumab, ofatumumab, cladribine, and alemtuzumab. Then we have a number of off-label treatments which are used for MS on an off-label basis: rituximab, azathioprine, cyclophosphamide, leflunomide. And within the hospital formulary, that means on the public side, we have only got 4 drugs, the 2 types of interferons, teriflunomide and fingolimod. Next slide, please. So how do drugs get onto the EML process? So I just walk you through the review process. The EML is regularly reviewed and updated to ensure the availability, accessibility, and affordability of these medicines for the Malaysian population. And who is involved in this EML process? Well, the EML process involves gathering feedback and opinions from KOLs, mainly the healthcare professionals, including consultants, specialist doctors, and pharmacists from the Ministry of Health, other ministries, and the private sector. And since a full assessment has already been carried out at a global level by the WHO expert committee in terms of disease prevalence, public health relevance, clinical efficacy, safety, and effectiveness, the current publication that you saw in the first few slides that I showed, the 22nd WHO EML, was adapted to the national Malaysian needs. So this entire process is summarized very briefly in this algorithm. And as you can see, this is the current stepwise manner in how drugs that are from the WHO publication is finally stratified as well as adapted to be used in the local situation at a national level in a country like Malaysia. Next slide, please. So at the national level in July 2022, the National Neurology Group on the public side met up, and the issue of availability, accessibility, and sustainability of medications for patients with MS was brought up. So the overriding question was, why is it we don't have MS drugs on the national EML? And we discussed about the successes in other subspecialties. So a unanimous decision was made to discuss at the National Therapeutic Drug Committee to include MS drugs on the EML. And a survey was done, and the majority of the 13 state public neurologists who came forward mentioned that the common drugs that they would need at the state level, which would be easy for them to use and for which they had experience and didn't require much monitoring, was mainly interferons. Sorry, I haven't put teriflunomide, interferons, teriflunomide, and rituximab. Of course, everyone is aware about the other lists of drugs, but these were the ones commonly that there was local experience and you have to adapt to the local situation. So they decided to use drugs which are simple and easy to use by all general neurologists without complicated monitoring. Next slide, please. So these were the criteria: simple to use, easy, available, evidence-based, easy to monitor, sustainable supply, on-label, off-label, and interferons, teriflunomide, rituximab were the main drugs that were discussed and were put forward to the national committee to be included in the EML. Next slide, please. So when you look at the Malaysian EML, there is a core list and there's a complementary list. So the MS drugs that were put onto the national EML come under the complementary list because these drugs need to a certain extent be prescribed by using with specialized diagnostic or monitoring facilities, and you need specialized medical care and specialized training to administer some of these drugs, especially with regard to rituximab. And of course, when using these drugs, it was advised that standard treatment guidelines be always referred to. Next slide, please. So this is the national EML, and the MS drugs come under the immunomodulatory list, and you can see interferon beta 1A, 1B listed here together with teriflunomide. And then on the off-label side, you see rituximab, where they have including biosimilars. And of course, we've also got azathioprine, cyclophosphamide, fludarabine, and under the rheumatology section, we have leflunomide as well in this particular list. So this comes under the complementary list of the EML on the national EML list in Malaysia. Next slide, please. So this is the journey, the National Neurology Committee, then at the National Therapeutic Drug Committee level, the National Pharmaceutical Regulatory Agency and the Ministry of Health, then listing it on the national EML, then finally getting the approval. So what does this mean now? We've got the drug on the EML. So now comes a little bit more of the difficult part. So engaging all key opinion leaders, mainly the pharmaceuticals, the Ministry of Health, procurement of drugs, discussions about tender, etc. Next slide, please. So our next steps at the national as well as state level is firstly to try and engage the pharmaceuticals. And we've tried this at preliminary stages, very challenging, I must say, because some of the originator drugs are still under what we call a tender. And that tender is a contract between the MOH and the originator drug companies. And we have to wait until these tenders expire to see if the price negotiations that we want to bring forward will be able to encourage the pharmaceutical companies to try and bring down the price. And of course, the on-label originator companies, they have the upper hand because some of these tender agreements are actually a couple of years, and you have to wait until these tender agreements expire. Secondly, trying to make MS drugs available in all state hospitals. So this is one of the pull factors for the companies, because if they sell the drugs at a very high value, very limited number of patients are able to access it. But while it's available in the EML, it means that these drugs should be made available at the public sector hospitals. So if they're able to bring down the price, then more number of hospitals at the state level in the country will be able to access these drugs. And this will bring on the purchase of drugs in bulk, as opposed to purchasing the drug on a named patient basis, where you only purchase it if the patients are existing in that particular state public hospital. And of course, looking at accessing generics, interferon and teriflunomide, before this, there was no interest, but now there are local distributors who are actually interested to bring generics as well as other biosimilars aside from rituximab locally. And of course, stocking up the non-public pharmacies with affordable biosimilars or generics so that patients can with MS can access them not only from the public hospitals, but public doctors can prescribe it and they can access it in the private pharmacies. So this would also help at this particular level. So these are some of the next steps we're thinking about. Next slide, please. So how would the MSIF WHO application help us? Well, using the current submissions to WHO, it will help us to advocate for other high efficacy treatments that are currently not available in our EML to be included locally based on the current evidence. And we'd also use the application to leverage for price negotiations, improve the procurement, talk about bulk purchasing in terms of originators and generics rather than quota-based or named patient basis. And some examples of what would be useful from the MSIF, etc., would be some examples of how to engage the Ministry of Health and Pharmaceuticals on access in other countries. And I think the first 3 talks were very, very helpful in this. And that would be very helpful for us in especially sharing their experience from our global colleagues. And of course, if there are tools to help us to explain the disease, that would also be very, very helpful. Thank you very much. That's from me.